Rare disease of sickle cell anemia. The mutation is a base substitution disease, and the red blood cell on the left is a perfectly normal blood cell, and the blood cell on the right is a sickle cell. It is not fully formed and is crescent shaped.
Oh! As you can see from this diagram, patients who have the sickle cell anemia disease have a mutation in chromosome 11. Now to you, Manja, how common is this mutation?
Sickle cell is most common in Africa, but it's also common in US and India. 1 in 400 African Americans are born with the disease, and 1 in 100 in Africa have the disease. Now Ravdeep, tell us who is at risk from this disease.
So Manja, both parents must have the gene. If one parent has the gene, then the offspring can be a carrier of the trait. If both parents have the sickle cell gene, then the offspring has a 100% chance of getting the disease. Ethnic groups like Africans, Middle Easterns, and Asians are also vulnerable.
Say what?
There are many signs and symptoms indicating towards the sickle cell disease, including shortness of breath, dizziness, headaches, coldness in hands and feet, and pale skin. Also, sickle cell results in sickle cell crisis, which causes severe pain in your lungs, joints, bones, and abdomen. This happens when the sickle cells block the blood flow to the limbs and organs. This can cause organ damage. Mentally, sickle cell can cause reduced quality of life owing to restrictions in daily functioning. And also, it can cause anxiety and depression.
Some treatments. During pregnancy, prenatal testing can be done to find out if a baby will have sickle cell disease. Most of these tests are available at most medical centers and hospitals. If you have sickle cell anemia, you'll need to make regular visits to your doctor to check your red blood cell count and monitor your health. Treatments may include medications to reduce pain and prevent complications. Children with sickle cell anemia may begin taking the antibiotic when they're about 2 months of age and continue taking it until they're 5 years old. Doing so helps prevent infections, which can be life-threatening to infants and children. Some interesting facts. Did you know that it's important to know whether or not you have sickle cell trait? People with sickle cell trait usually do not have any of the symptoms of the disease. There are some flaws with this though. You cannot go in high altitude areas, you can't be in increased pressure areas, and you get dehydrated really quickly. Another fact is, a person with sickle cell trait can pass the disease on to their children. Last but not least, my favorite fact. Did you know there's a cure for sickle cell disease? Bone marrow cell transplants can cure sickle cell disease. Bone marrow is a soft, fatty tissue inside the center of the bones where blood cells are made. A bone marrow stem cell transplant is a procedure that takes healthy cells from someone like me and gives it to someone who needs it, like someone with sickle cell anemia.